non-American to hold a senior management position within NASA, where he was appointed Director of the Space and Life Sciences Directorate and Deputy Associate Administrator of the Office of Spaceflight at NASA headquarters. Welcome, Dave.
Thank you very much. I'm thrilled to be here.
Dr. Robert Thursk is a Canadian engineer and physician and a former Canadian Space Agency astronaut. Dr. Thursk earned a Master of Science degree in Mechanical Engineering from MIT in 1978, his medical degree from McGill University in 1982, and an MBA from the MIT Sloan School of Management in 1998 as a Sloan Fellow. In December of 1983, Dr. Thursk was selected by the National Research Council of Canada to join the Canadian Astronaut Program, later serving as Chief Astronaut of the Canadian Space Agency in 1993 and 1994. In 1996, Dr. Thursk flew aboard Space Shuttle Mission STS-78, the Life and Microgravity Space Lab mission. He holds the Canadian record for the most time spent in space at 204 days and 18 hours. Following his astronaut career, Dr. Thursk worked for the Canadian government's Health Research Investment Agency, the Canadian Institute of Health Research, as President of Public, Government and Institute Affairs. He became an officer of the Order of Canada in 2013. Welcome, Bob.
Thanks, everyone.
Joining us as well is Ms. Katrysha Gellis, who exactly 5 years ago to this day, October 16th, without warning, suffered from a cardiac arrest at work at the age of 30 years old. Thanks to the quick action of her friends and colleagues, she survived. Since she was given a second chance at life, Katrysha dedicated herself to teaching others the power of saving a life, as founder of Living Proof CPR training. In addition to sharing her story as part of the McGill WRAH 2020 campaign, Katrysha is a member of our campaign steering committee. Katrysha, what an honor it is to have you present amongst us.
Thank you for having me. I'm honored to be here, and I'm always happy to share my story if it can bring awareness to the importance of CPR and using an AED to save a life.
We are also joined by Mr. Simon Bichara-Allard, a good friend and third-year medical student and a dedicated ambassador relations member of our campaign steering committee, or student committee, sorry. Welcome, Simon.
Thanks, Jeremy.
Finally, I have the privilege of being joined by Dr. Matthew Hanush, the Neurocritical Care Division Director at the Neuro and McGill University Health Center, a critical care physician and head of the organ and tissue donation program at the MUHC, and an organ donor physician at Transplant Quebec. Dr. Hanush is one of several emergency and intensive care physicians on our campaign steering committee. Welcome, Matt.
Thank you, Jeremy. Happy to be here.
As part of this year's campaign, Katrysha is sharing her personal connection to cardiac arrests. The following video is a telling narrative of Katrysha's experience. Please stand by for the premiere of Katrysha's story.
I am Katrysha Gellis, a sudden cardiac arrest survivor. My colleagues told me that one moment I was eating lunch with them and the next I was unconscious and not breathing on the floor. Nobody really knew it at the time, but I had suffered a sudden cardiac arrest. I feel very fortunate because I was in the right place at the right time with colleagues who did exactly what you're supposed to do. And because of their actions, they saved my life, and I'm here talking to you today. Luckily, there was a team of firemen who happened to be finishing a call around the corner. They were at the scene within a couple minutes with a defibrillator, and they attached it to my body, and they shocked me twice, and my heart was able to be restarted, and they saved my life. Sudden cardiac arrest is just that, it's sudden. It doesn't have any warning signs. It can happen to anyone at any time. It doesn't discriminate, and it's not just something that happens to older people. It can happen to somebody who's young. I was 30 years old when it happened to me. I wish that people don't have to be in the right place at the right time to survive a sudden cardiac arrest. I really hope that my story will inspire people to empower themselves with the knowledge of how to do CPR and how to use an automated external defibrillator, because they could be the difference for someone. They could make a difference. They could save a life. And I'm living proof of that.
Members of our student and steering committees have also come together to present an impactful and actionable approach to responding to cardiac arrests. In the next 60 seconds, we invite you to learn how to save a life. Please stand by for the premiere of our campaign's 60 seconds. In Canada alone, every 12 minutes, someone suffers from a cardiac arrest. If you don't do anything, they are going to die. In the next 60 seconds, we're going to teach you how to save a life.
If you see someone lying unconscious, the first thing you want to do is check if they're responsive. If they are not responsive and not breathing or breathing abnormally, they are likely suffering from a cardiac arrest.
Call 911, let them know that someone suffered from a cardiac arrest, send someone to find an AD if there's one nearby, and then start chest compressions.
For chest compressions, find the center of the chest, put your dominant hand down, interlock your fingers, and push hard and push fast.
Using an AED is really easy. You just apply the pads, turn on the machine, and follow the voice instruction. The machine will analyze the rhythm and tell you if a shock is recommended.
Katrysha, allow me to begin by thanking you for your courage and generosity in sharing such a personal and tragic moment. We hope that efforts like this campaign bring deeper meaning to your experience. Katrysha, what more can you share with us concerning your cardiac arrest exactly 5 years ago? This will be followed by a discussion with Dr. Hanu.
Thank you, Jeremy, and thank you again, and all of you for being here to chat today. I think this is a really important discussion, and as I said, I'm really always happy to share my story if it can inspire just one person to empower themselves with the knowledge to know CPR and to use a defibrillator, because I think that my story really illustrates the fact that, you know, bystander intervention is so important and it can save a life. And in my case, I was at work, I was with colleagues, and I think they executed the first steps in the chain of survival to help me survive. So I was eating lunch, I had no health issues or warning signs. They told me one moment I was awake and conscious and talking, and then the next I said, I don't feel good, and I collapsed. Excuse me. And so I think that the fact that they recognized I was in sudden cardiac arrest, they called 911 right away, they started chest compressions, and because of their quick actions, there was a team of first responders who brought a defibrillator that delivered a life-saving shock to me and was able to allow my heart to restart. Because of their actions, I'm alive. And the people involved in saving my life, there were 8 of them. So there were my 2 colleagues, there were 4 firemen who had the AED, and then there were also 2 paramedics. So the chain of survival was executed, starting with my colleagues who were able to recognize and start CPR, and then the firemen who used the AED to restart my heart, and then the paramedics who were able to take over and give me extra care and bring me to a hospital where I could get the treatment that I needed from a doctor. And I think that my story, you know, it's a powerful one, and I'm just so honored to share it for World Restart a Heart Day and for this campaign. And I think it really illustrates why this campaign is so important. And I'm so proud of all the students for taking the initiative to make this happen, because I think it's going to make a big difference.
Katrysha, if I could take a moment and just, everyone else has thanked you, but I want to thank you again, because I've heard your story before from you, and yet every single time that I hear it, it still has an enormous impact on me. And I can only imagine how difficult it must be to relive those moments. So where do you draw that inspiration to kind of go back to that time and have us hear it for the first time? But you're hearing this now, it's been 5 years. So how do you manage that and realize that this is so inspiring for us? It has such a profound impact, not only on, as you're saying, the bystanders and the layperson that learns from this, but for people like myself that are in the healthcare system that can finally have these positive, enormous, really impactful stories.
I mean, it's definitely not something that I was able to share and talk about right away. It did take me a lot of time to process. But one of the things that I always keep in my mind is, you know, this is a difficult thing for me to have gone through as a survivor, but it's such a difficult thing for family members of survivors to go through too, because it changes your whole life. And it is a very traumatic experience. And, you know, one thing I always keep in my mind is the people that didn't survive and their family members. So I have friends who have lost people from sudden cardiac arrest, and I'm always thinking about them. So when I do share my story, I know I'm sharing it for them, and you know, it's not going to bring anybody back, but I'm hoping that we can spare other people the pain of losing somebody from this.
Yeah, I agree. That's fantastic. That's all.
In your testimonial, Katrysha, you mentioned how you feel very fortunate because you were at the right place and at the right time. Can you elaborate on those thoughts? Like, why must we change this?
Sure. One of the things that we know is that, based on statistics, is that the survival rate right now for sudden cardiac arrest outside of a hospital is lower than 10%. So surviving is not something that's common. It's more common not to survive. And one thing that I've heard, I've been very fortunate to meet some incredible people during this journey of mine, other survivors who shared their stories with me. And one of the common themes I hear is that all of their stories are the same, in the sense that they survived because they were in the right place at the right time with people who knew what to do, and probably with a defibrillator that was applied within that precious 4-minute window. And I'm hoping that in my lifetime, and with the advocacy work that we're all doing to try and bring awareness to this, is that we can flip the statistic around so it becomes more common to survive a sudden cardiac arrest, because simply we have more people around who are trained in bystander CPR, and we have more AEDs available, so that you will probably be in the right place at the right time, because it's not a matter of if there's going to be a sudden cardiac arrest that happens today. It's a matter of when it will happen and where it will happen. And I just hope that when it does happen to that next person who's going to experience this, that there are people around who can really jump in and help them to save their life.
Thank you, Katrysha, for sharing your incredible journey. Matt, as a critical care physician who cares for the sickest of patients and actually leads resuscitations, what message do you have for cardiac arrest bystanders who are scared to intervene and feel that they can do more harm?
I think this is a huge issue, and Katrysha touched on it a bit too. And I think that the first place to start is by always reassuring everyone here that you can do no harm. And I can't reiterate that or enforce that enough, that this is one circumstance when you're faced with a catastrophic event where, in the healthcare system, we balance the risks and benefits of every action that we take. Whereas here, you have a moment to intervene in someone's life, and only for a positive outcome or benefit or effect. There is no harm in attempting bystander CPR, and you can only have a positive outcome on that person's potential resuscitation and outcome in life. And I think it's just such a fantastic moment to realize that you cannot harm this person. Okay, I cannot stress that enough. And I think that once we kind of get past that challenge, that hurdle, you have so much that you can draw from that experience. And as Katrysha has testified to that. You know?
Absolutely. Thank you. Thank you, Matt. We have the privilege of having two astronaut physicians present. Dave, as a past emergency physician and astronaut, could you tell us what your experience with cardiac arrests and resuscitation? I'll let Simon continue the conversation with you, Bob.
So there's no question that learning CPR is absolutely critical for everyone in society. You know, we think so often that this is something that only healthcare professionals should know. In fact, it's something that we all should know. Imagine if we were taught this in school, whether it's elementary school or high school. Imagine if automatic defibrillators were as prevalent as fire extinguishers. I mean, how often do buildings catch on fire? I don't know the statistic, but if you think about how often sudden cardiac arrest occurs in the pre-hospital environment, it begs the question, perhaps we should have defibrillators more broadly dispersed throughout society. But I've resuscitated many, many individuals as an emergency physician with all the equipment that I have in the acute resuscitation area of the emergency department. The first time that I actually ever did CPR outside the hospital was 2 weeks before my first space flight, and somebody rang the doorbell, and I went and answered the door wearing a t-shirt and jeans, and they said, "Do you know CPR?" And I thought, this isn't a survey from the American Heart Association, right? So I went running down the street, and there was a 17-year-old girl who'd had a respiratory arrest, lying there prone, cyanotic, etc. So I was able to actually successfully save her life. And that single experience, that outweighed everything that I'd done where I was doing my job as an emergency physician. And the comments that you've heard today are so important. Don't be afraid to intervene. Even if you simply call 911 and activate the system, that's the important first step. But don't be afraid to do what you're taught to do. And if you don't know how to do CPR, go out and get a course today.
It's amazing. Thank you again, Bob and Dave, for being there. I consider myself very lucky to have the chance to talk to you guys. Obviously, I'm a medical student, but I'm also consider myself a huge space enthusiast. So I'm a bit starstruck and really happy to be talking to you. I'm going to direct the questions to one or the other, but obviously, if you both want to chime in, it's welcome. I'm going to address myself to Bob next. Obviously here on Earth, we have some very well-established protocols for CPR or for emergencies. I was just wondering, from your experience, what can you tell us about the measures that are put in place for acute care in space? Are there provisions for space resuscitation, or what, if I don't know if CPR has ever been performed in space, but if it were to happen, how would it work?
All activities of daily life need to be rethought in space. So what that means is that we need to rethink common activities like brushing your teeth, taking a shower, operating electric drill, and also rethinking how we do cardiopulmonary resuscitation in space as well. Yes, the answer is yes. We do have resuscitation equipment aboard the space station and the shuttle. We have defibrillator, we have an automated ventilator, we have cardiotropic drugs. And since my flight, Katrysha would be happy to hear that there's also an AED on board the space station as well. You know, the way you do CPR in space is different. The first thing is that if there is an astronaut victim, we need to bring that person to a central location in the station, to a restraint bench, and perform CPR there. The reason for that is that the entire space station is made out of metal, made out of aluminum. So if you defibrillate someone, then there's going to be consequences for the operators as well. So the restraint bench is non-conducting, and the first thing we'll do is we'll strap the victim into onto the bench first. The second thing is compressions. In an Earth environment, of course, the operator typically kneels next to the victim and provides the chest compressions by kneeling adjacent. Well, again, in a weightless environment, you can't do that because of Newton's third law. You apply one chest compression and you're flying off as the operator in the other direction. So we do either have a restraint system that can hold us down to the side of the restraint bench, or what the vast majority of us astronauts like to do is to provide chest compressions with our legs. So we'll flip 180, put our feet on the ceiling, and with standing inverted over the subject, we'll use our legs to provide the chest compression. Drugs, you know, are available there. All the typical drugs that you'd see in an emergency room or at a clinic to resuscitate. But sometimes we don't have a medically trained astronaut on board the flight. So we'll try to get an IV started, but sometimes we'll have to use other ways of administering the drug. Sometimes down the ET tube is an example. So, you know, all astronauts are pretty healthy. We would not qualify a person with coronary artery disease to fly in space. Nevertheless, sudden cardiac arrest could occur during a space flight, maybe through trauma or maybe through electrocution. So we continue to train on the ground for our CPR skills. And in fact, during flight, we continue every month or two, we as a crew tend to go through a simulation scenario and keep our skills fresh.
Thank you. That was really interesting. We don't think about these things here, but yeah, obviously it's quite different there. I personally watched a bit of your podcast on the CSA website, and some of the questions that I thought about were inspired by this, and especially the next one. Going to space, especially for a long period of time, it must come with a lot of unknowns, especially in terms of how the body might react to the weightlessness and the exposure to potential higher radiation doses. I was just wondering, what were, for both of you, some of your biggest apprehensions in terms of your health before leaving, and in the end, after going through your space travels? What are the biggest challenges that you had to overcome from a physical standpoint?
Go ahead, Dave.
Okay, well, sure. There are a lot of changes that take place in your body when you go to space. And I'm what you would call a short duration astronaut. My first mission was 16 days. That was back in the era where a long mission was considered 5 to 7 days. So I guess to a certain degree it was long, but by today's standards, it's nothing. And then the second mission was 14 days. Bob, of course, holds the record for the longest flight. When you're in space, you lose muscle strength, your bones become weaker. It's quite an interesting phenomenon. In many ways, it's very similar to what happens as we get old on Earth. If you were to stand up in a gravitational environment after being in space for a period of time, it's very hard to stand up and you feel lightheaded. We become what we call orthostatically intolerant. In other words, you feel like you're going to faint. If you turn your head quickly, you feel the world spinning around. And of course, the radiation effects and some of those other things may have long-term health consequences. So what we do is we work really hard to optimize the individual's ability to fly in space with a strong physical conditioning program before flight. On orbit, we have what we call a countermeasure program to basically enable the astronauts to exercise, to maintain their cardiovascular fitness, aerobic capacity. We have strength training that we can do in space as well to maintain your muscle strength and optimize your bone density and try and reduce the rate of bone loss. And all of that helps prepare for re-entry. And needless to say, I can tell you after even a short duration mission, when you land on Earth after being in space for a while, you feel gravitationally challenged. And you lift your arm up, it feels really, really heavy. You can imagine. Bob, tell us what you went through, because after being there for a couple hundred days, I'm sure it was pretty dramatic.
Yeah, some of the countermeasures that we have aboard the space station include exercise machines. We spend 1 hour doing aerobic exercise every day, and I spend 1 hour doing muscle resistance work. And I was pretty religious about following the exercise regime. But you're absolutely right, Dave. In spite of my dedication to the exercise program, on the landing day, I landed in Kazakhstan. I did not have the strength to get up out of my chair. I needed to wait for the search and rescue people to come and help me out. It's that degree of fatigue and weakness that we nevertheless have to endure post-flight.
So needless to say, we do a lot of research to study all this, and we need to learn these lessons to be able to leave low Earth orbit, go back to the moon and on to Mars. And defibrillation, on STS-90, my first space flight, we flew the first defibrillator in space. So developed all those protocols for resuscitation using the CMRS and the feet on the ceiling. That's a pretty cool thing to be able to do. We did a lot of that in parabolic flight on what we call the Vomit Comet, the KC-135 airplane that goes up like this and down like that.
Very interesting. I was wondering, just a follow-up question, how long did it take for you, maybe Bob, to regain a level of comfort on Earth when you came back after those 6 months?
Well, it's probably true to say that every organ system in your body readapts back to 1G, back on Earth at its own pace. So the cardiovascular and the vestibular system seemed to readapt after 2 or 3 days back on Earth. I was no longer lightheaded. I didn't have the twirling sensation that Dave mentioned. With a really good rehab program and instruction from a trainer, I regained my muscle strength and mass in about 6 weeks post-flight. And then the general rule of thumb is that for every month that you spend in space, it takes 2 months back on Earth to regain the bone calcium that you've lost. In my case, I think it was a little bit longer. I think it took about 1.5 years to regain the bone mineral density that I had lost.
Oh, that's quite the commitment, knowing that you're going to have to spend 1 year recovering from that. But that's amazing.
Small price to pay.
Obviously, I was going to direct my next question to you also, just because I know that you also flew aboard Columbia. I think it was your first flight, if I'm not mistaken, and your crew was sent there to study muscle function and physiology. And obviously, we know that the heart is a muscle. So I don't know if you can share. And then you spent obviously the 6-month expedition further studying human health. So I don't know if you could share with us maybe a little bit of what you learned, if you learned something particularly considering the cardiovascular health system.
We did 43 different experiments from a variety of disciplines. I think really the focus of that flight was on the muscle system. We anecdotally, prior to my first flight, heard that muscles tend to get weaker in space, but this is the first time where we actually documented the loss of mass and the loss of contractility. A lot of the lessons that we learned during that flight, we applied to develop the countermeasures that today we fly aboard the International Space Station. So it's, the concentric and centric kind of workouts that we do, they're all finely tuned and based upon the research that we did during my first flight. Another astounding observation was that we begin to lose bone calcium immediately upon entry into weightlessness. On the Columbia flight, we were taking blood samples from each other within 20 minutes of arriving on orbit. And we already saw the spike up in calcium that was coming out of our bones into our vascular space. We also looked at the rate of bone loss as well. It's marked. The rate of bone loss in astronauts in weightlessness is 4 times that of a postmenopausal woman. So it was basically some of this basic research that we did on the Columbia flight that helped us to develop the protocols, the countermeasures for the International Space Station era.
So we were kind of the guinea pig for the next generation. That's great.
We had a nickname for our crew. We called ourselves the RAT crew, as in laboratory rat.
Awesome. And my last question will be addressed to both of you. I know you both used simulation as a tool to get prepared. Obviously, space missions are very well known for this. And the McGill WRAH We Started Hard campaign is based out of McGill's Faculty of Medicine and Health. And it's supervised by the Steinberg Simulation Center at McGill. So I was just wondering if you, from what you experimented in space and throughout the simulation, if you saw further opportunities for simulation in the medical field and training of future healthcare professionals.
Go ahead, Dave.
Okay, thanks, Bob. This whole area of simulation is absolutely critical. One of the things that's so important in medicine is providing a safe environment for learners to learn how to do things, but also to be able to experience failure without having a clinical consequence. You can do that in a simulated environment. You can set up an opportunity for medical students and residents to learn how to run a cardiac arrest. They can make their own judgment decisions. They can choose what drugs to administer, and if things work out well, that's fantastic. If there's a problem, somebody makes a mistake, or there's a medication error, there's no clinical consequence, and you can learn from that. Failure is very instructive. In fact, I've learned more from my failures in life than I've ever learned from my successes. But in medicine, just like in spaceflight, we need to be able to provide that safe environment where people can learn without fear of making mistakes. It's really interesting that in aviation, I can go get type rated on an airplane based on the fidelity of the simulator. So CAE in Montreal makes some of the world's best simulators. We have pilots that get type rated on a Boeing 787 based on the fidelity of the simulator. And we're going to get there in medicine. It's going to take us a little bit of time, but we will get there. Today's simulators are fantastic, but we want to make them more accurate, more reliable, and more lifelike to be able to help the trainees learn.
Amazing.
Like Dave, I've made dozens of mistakes in my career, but most of those mistakes have been committed on the ground. When you're in space, you often only have one chance to perform an operation correctly, and that's because of the constraints, the tightness of the timeline or the orbital constraints that we're in, and also the nature of the work. The work that I'm doing in space sometimes is going to be used by a grad student who's hoping to get the data from me to get a PhD and graduate. So the work is very important. I don't want to make my mistakes in space. I want to be perfect in space, similar to the medical profession as well. So I try to make as many of my mistakes as possible in training, and the simulators are a cornerstone of astronaut training.
Yeah. Let me just comment about making mistakes, because it's so important. In the context of a cardiac arrest, sudden cardiac death outside of the hospital, the biggest mistake that people can make is not to use the AED because they're afraid of using it. We've had elementary school students demonstrate their ability to set up and use an AED. It's not difficult to do. Don't be afraid of using the technology.
Thank you both for sharing your incredible journeys and experiences. Katrysha, you wanted to say something.
Oh, I just wanted to say, I think that's a great point. I'd like to add to that I heard someone say once that the only way you could hurt someone with an AED is if you hit them on the head with it. So don't be afraid to turn it on and just listen to it. And it is automated, so it will analyze the person's heart rhythm. And if they don't need a shock, it will never deliver a shock. So you can never hurt the person with an AED.
Absolutely, very well said. Over the past days, our social media team has been collecting questions in preparation for this live event. We've compiled a list, and I will be directing several to our invited guests and experts. So beginning with you, Katrysha, what does life look like after surviving a cardiac arrest?
Well, I mean, I'm really fortunate. I think I'm in a really good position, and I feel good now. But there's definitely been ups and downs over the past 5 years for me. I think there's two things that are true. One is that everybody's experience with this experience of sudden cardiac arrest is very unique and different, and not every survivor goes through the same thing. So I know that what I've experienced is different from someone else. And the second thing is that it is a trauma. It's a trauma to your body, physically and mentally. And like with any trauma, I just don't think that you really fully get over it. Like, I'm never going to have it not have happened to me, but it's something that I think we move forward with. And it's part of my story now. And my life after the sudden cardiac arrest, I really felt inspired to pay it forward and to thank my rescuers for saving my life by paying it forward to teach other people about CPR. So obviously that's one of the big things that's changed, is I'm very passionate about that now. Something else is that I do have an implantable cardioverter defibrillator installed inside me. It's always monitoring my heart rhythm. So that gives me a little bit of peace of mind. If I ever did have a cardiac arrest again, I know that it would give me a shock. I guess on a little bit lighter note, one thing I did, I asked my doctor, do I have any restrictions now, or the things I can't do? And the one thing he said is, well, you're not going to go to the Olympics now. And I mean, I had come to terms with that a long time ago, so it was okay. But pretty much I feel fortunate. I have such a wonderful support system of friends and family and a partner who are there for me. And I'll just say that that's been a really important thing having in my life post-cardiac arrest, is people there who, they may not understand what I've gone through, but they've always been there for me. And every day is different. Some days are really great, and some days I feel a lot. And there's a lot of big feelings that happen. So yeah, so that's been my unique experience. And I just feel very fortunate and grateful to be alive. I don't know if we have time. I just wanted to add one more thing that I think, I really want to bring this up. I think it's an important thing for us to talk about, because I don't think we talk about it enough. But one thing that I think a lot of people do experience, and that I personally went through, is cardiac depression after experiencing a cardiac event. And talking to people who've gone through this, it isn't talked about enough. And I think there's a lot of guilt that comes with it. You feel like, I survived, I should be so grateful, I should be so happy. And sometimes you just don't feel good. You feel sad and upset, and you don't know why. So I would just say to anybody watching out there who, is dealing with a family member that's going through this, or who's going through that themselves, it's normal and it's okay, and you're not alone, and it's okay to get help if you need to talk about how you feel after experiencing such a traumatic event. And I did, and it was really helpful for me.
That's so powerful, Katrysha. Thank you for opening up once again, and for really sharing your story with us. Space and flight are closely intertwined. And while most of us won't get to be experiencing traveling in a space shuttle, many of us will return to traveling by plane in the foreseeable future, hopefully. So beginning with you, Dr. Williams, and perhaps complemented by Dr. Thirsk, what guidance can you provide to bystanders who may witness a cardiac arrest while traveling on a flight?
So the greatest time of risk in flying commercially on an airplane is actually before and after getting on and off the airplane. So that's why automatic external defibrillators tend to be very prevalent in airports. And in fact, a number of studies have been done at this. And I guess it's kind of natural to think about that. People are running and they're trying to get to their flight. They're running late. They're dragging their luggage. And that set of circumstances can probably increase the probability of a sudden cardiac event for somebody who has underlying cardiac disease. If you're on board an airplane, many airplanes these days are carrying automatic external defibrillators on board. Many of the airplanes today, the flight crew can actually reach out electronically to doctors on the ground to get real-time medical advice to manage an in-flight medical emergency. Again, don't hesitate to do the right thing. If you're on board an airplane at 35,000 feet, well, then in a situation like that, if you're trained in doing CPR, do what you're trained to do, and the flight crew will help you out. They have oxygen on board, and they'll divert the airplane to be able to land early. But these are all opportunities for us to remember that each of us can make a difference at any time if there's an event of sudden cardiac arrest that we witness.
Dr. Williams, you've led clinical research on resuscitation and out-of-hospital cardiac arrest. What can you share with us about your findings?
So the most important thing is the time to defibrillation, that early initiation of the system. Now, if an AED happens to be immediately available and you get defibrillation within 30 seconds to a minute, the outcomes can be fantastic. And what we're really interested in is not just simply surviving cardiac arrest, but being able to survive cardiac arrest and return to your life the way you once knew it. And, you know, we've heard from Katrysha the challenges associated with that. But if we're able to save someone's life and they're not functioning neurologically and things, that's really tough. So what we're trying to do is get that immediate response by using an automatic external defibrillator. If there's not one around, activate the system, do your CPR, and as soon as one arrives, it's that time to onset of defibrillation that makes a difference.
Thank you very much, Dave. The dream of making humanity multiplanetary is becoming closer to reality. With an expertise in research and healthcare governance, what does that path look like from a healthcare perspective, Bob?
Well, the first 60 years of human spaceflight have more or less been confined to low Earth orbit. And that means that medical care to the onboard astronauts is largely directed from the ground. And we did that because of the abundant communication we had between the spacecraft and mission control, and also the nearness to tertiary care centers on the ground. We can get an astronaut usually down to the ground if required within 24 hours or so. But the future, as you mentioned, is interplanetary. In the next 5 years, we'll be returning to the lunar surface. We'll be in lunar orbit. And about 15 years from now, we expect that the first human exploration mission will head off to the red planet, off to Mars. The features of these deep space missions are going to be totally different. Number one, because of the distance. Mars, when it's furthest away, is 400 million kilometers away from Earth. There's also a data and voice latency between Earth and Mars, up to 20 minutes, which means that if you're an astronaut on Mars and you call me at mission control to say that my astronaut colleague, Yuri, has just had a cardiac arrest, it's going to take 20 minutes for me to hear you say that. And it's going to take another 20 minutes for me to tell you to get out the cardiorespiratory resuscitation equipment. So right away, you know that the astronauts on deep space have to be more autonomous. There should be a medical doctor that's part of the crew, and we'll rely upon AI or machine learning entities like R2D2 to help out with some of the health monitoring, the diagnosis, and the treatment as well. Patient care is going to have to be more patient-centric, meaning astronauts will have responsibility for monitoring and directing their own health care. And then a lot of the laboratory facilities are going to have to be point of care on board the spacecraft because we just can't return astronauts to the Earth for medical care. It's going to be a totally different way of operating. But it's a challenge. I think Canada and McGill University could grab and run with. I did my family medicine residency program through the McGill University system. There's some great remote healthcare that's being directed out of McGill. And then, of course, we have Mila, the AI ecosystem in Montreal as well, which can help us with some of the automation of future healthcare delivery for astronauts.
That is so interesting. Thank you, Bob. Can you take us through the chain of survival quickly, Matt? And exactly how do we give chest compressions?
Thanks, Jeremy. It's a good question. I think we should come back to it and focus on the very simple steps that we can all take for bystander CPR. And we've alluded to them so far in this talk, and that is just make the call to 911, either yourself or someone around you. Someone scream or get an AED to the patient, to the layperson as soon as possible if it is available, and then start chest compressions. And chest compressions, we don't have to complicate this. Okay, it's actually very, very simple. All you have to do is take your dominant hand, put it over the chest, interlock your fingers, keep your elbows straight, push hard and push fast. And do not worry about causing any harm, like we keep saying, or any injury. You can only help and only cause and hopefully lead to a positive outcome. So hard and fast, fingers interlocked, elbows straight, push hard and fast. Make sure someone calls 911 or EMS and someone gets you the defibrillator. Then once you have the defibrillator, as Katrysha described so well, don't hit them over the head and just attach it, turn it on, and let the automated voice prompts do all the work.
That's great, Matt. Thank you. And you know, as as virtually everything else has, the COVID-19 pandemic has had an impact on everything from probably spaceflight to healthcare, obviously. And so, how has the chain of survival and bystander resuscitation changed in the times of the coronavirus pandemic, both within the hospital and outside the hospital?
Another good question. I have to first preface it by saying it's been refreshing for 45 minutes to not have to speak about this pandemic for a change, and another very important topic. But I think we do have to put it in the context of the reality that we are all living in. And so while some things have changed, the majority of it has all stayed the same. And I want to reiterate and focus on that you have to just act immediately and do your best at bystander CPR. What you can do, the one change that we've tried to incorporate in this process, is if you have any fabric or cloth that you can put over the victim's face or mouth and nose, that could, to a certain extent, protect everyone around you if they have contracted the virus or not. And then once the CPR has finished and the patient has been picked up by the EMS or 911, Urgence Santé, well, then that cloth can be just simply thrown away. So I don't want to complicate it more than it has to be. It's a very simple procedure, the whole thing. And the only thing that we can add is that simple additional step of placing the cloth over the victim's face.
Absolutely, and I'll just emphasize, Matt, that 55% of cases, or up to 55% of cases of cardiac arrest, are within one's home or between one's family and friends. So in those cases, of course, there's a certain level of comfort that you can have with your family, and you could know that you'll likely be resuscitating a loved one if you are to be resuscitating someone. So in those cases, of course, as you confine together and as you stay together, there wouldn't be any need to use additional precautions. And I think that's worth emphasizing because people need to realize that. People need to realize that sudden cardiac arrests are not a strange thing that happened to some individual that you come across on the street. These are things that happen very close to home. These are things that can happen to your parents, to your siblings, and to your children. And we really want to emphasize that today. Matt, many individuals, they lose hope during a bystander resuscitation, and they're under the impression that even if they resuscitate someone to spontaneous circulation, the chances of them recovering neurologically intact are low. As a physician experiencing this on a daily basis, can you speak to this?
That's another great question. And I think that that happens to be the one scenario where in reality, and without exaggerating, that is the opportunity we have to have a positive outcome and a good, what we call neurological outcome from this. So if someone is performing bystander CPR, you should be encouraged and empowered to know that you may be leading to a very good outcome for that person that has and again, Katrysha is our witness statement today. That's fantastic that we have that, and it encourages and inspires me. The reality is that in the healthcare system and in the hospital and in the ICU is that the majority of patients that we care for are not the patients that have had the luxury or the privilege or to have received bystander CPR, and they get the majority of our time and focus. And you're right that those patients don't have perhaps good outcomes, whereas this is the complete opposite that we're discussing today. If we get to these people timely and perform bystander CPR, that's where we can really have a great outcome.
So on a final note, Matt, if you could leave our viewers with one message, what would it be?
To try not to sound like a broken record is to act, do something, make the call to 911, find the AED and start CPR. You won't harm, you'll only help. It'll be an incredibly moving and empowering experience for everyone involved that you have. We overuse the term life-saving or saving lives, or you hear that thrown around a lot. This is the one major experience in everyone's life where you can actually, quite literally, do that. So please, please try.
Today's event will be followed by a pediatric cardiac arrest survivor story, organized in collaboration with the Montreal Children's Hospital Foundation. Visit www.mcgill.ca/WRAH to discover the campaign, its impactful videos and live events, and follow #McGill WRAH or McGill WRAH on social media platforms. This is Jeremy Levett, Chair of the McGill WRAH 2020 campaign, speaking to you as part of our live event series. I've been talking with Drs. Dave Williams and Robert Thursk, both Canadian astronauts and physicians, Ms. Katrysha Gellis, a sudden cardiac arrest survivor, Mr. Simon Bichara-Allard, a medical student and student member of our World Restart Heart Pain Student Committee, and Dr. Matthew Hanush, the Neurocritical Care Division Director at the Neuro and McGill University Health Center, critical care physician and head of the organ and tissue donation program at the MUHC, and an organ donor physician at Transplant Quebec, and member of the McGill World Restart Heart 2020 campaign steering committee. Thank you all for your remarkable service, and thank you very much for joining me today.
Bye, everyone.
Bye.
Bye.
Thank you.